Welcome to Wealthy Sis Talk Show. And I am Noni with your Deaf Friendly Doula. Today we're going to be debunking some of the myths that we hear about that comes with having a doula. And one of the myths is doulas are only for wealthy families. That is totally untrue. I'm going to give you a list of, in 2026, the states that actually have established Medicaid for doulas. There's California, Colorado, Illinois, Massachusetts, Michigan, Minnesota, New York, Oregon, Rhode Island, Washington State, and Washington, D.C. Florida offers doulas here that's through Medicaid as well. I'm going to give you some examples. Like one of the Medicaid insurances that I believe is the best is one is Sunshine. When you have Medicaid, you do not have to stick to just one insurance. You can always change your insurance. And if you want a doula and you are on Medicaid, I would say get Sunshine, because Sunshine offers prenatal doula services when you have your baby, and also up to a year of postpartum. So the myth of them saying that you have to pay for it and it's just for the wealthy, it's not. Even if you have a private insurance, your insurance also can cover doula services as well. They also have some other states that are actively implementing some coverages: Arkansas, Louisiana, Montana, Utah, Vermont, Maine, and New Hampshire. Not only are the doula services are covered, they also cover prenatal, they cover labor coaching, they cover childbirth classes. So doula support is becoming accessible to all families. It is not just for the wealthy. The second myth we're going to talk about is doctors and nurses replace the need for a doula. Again, totally untrue. So I'm going to break down the difference between the nurse and the doctors, which is clinical care. That means they monitor vitals, the fetal heart rate, labor progress. They are in and out of the rooms, they rotate shifts, and they have pain management with medication. That's usually what the nurses and the doctors do. But when you come to the non-clinical side of it, far as a doula, we are the emotional and the support for that's continuously. So we are there from when you go into labor, or actually when you call us, until you have your baby. And if you hire us as postpartum, then we're there until after you have the baby. One of the things that I wanted to let you guys know that we do is we also give you pain relief. So while the nurse is giving you the medical side of medication, we are coming in with comfort measures, hip squeezes, massages, different things of that sort. So we reduce stress, you have a better birth experience, you have a stronger communication, and especially this actually helps for deaf patients too. Now we're going to go into myth number 3. Doulas are only for natural and home births. Again, this is totally untrue. When I come in for the hospital set, we want to create a vibe and a good environment, not only for you, but also for everyone else that's coming in the room. So just imagine you have all these lights that are bright, you have these machines that are turned up. That's not going to keep you calm. So when I come in, we're going to lower the lights. Actually, we're going to turn the lights off if we can, and we're going to put on some candles because that's going to set the mood. We're going to give you the sense to actually give you a sense of calmness, because you don't need to be hearing all these noises and things like that. So I'm going to ask the nurse to turn the machines down. A lot of people don't understand that. Yes, you can turn the machines down, because what do you need the machines? It's connected to outside of the room for them to keep the monitor going. So you don't need to hear all of that. We're also going to bring in like if it's cold or if it's hot, we add a fan. If it's super cold, then you can bring a blanket that's from home that can actually make you feel more comfortable. Okay, let's say you're having a C-section. I'm coming in with reassurance. We're going to go over all the affirmations that we did a couple of months ago prior to this to keep you calm. I'm going to assist with your partner so that he can keep you calm, or she. We're going to go with, once you have the baby and the cesarean is done, instantly we're going into skin to skin so that we can get you with some bonding just giving you tips, some things that I believe the clinical side is not going to help. We're going to go into inductions. If you're having inductions, that means they're going to actually give you Pitocin. And I'm trying to help you get your natural oxytocin going. So we're going to do some comfort measures. We're going to do some massaging. We're going to do movements. We're going to do things to just bring the medical side down and your natural state up. Because that's what we need for you to have this baby. Now we're going to continue on to myth number 4. Deaf families don't have accessible doula options, which is completely untrue. As for me, as a Deaf Friendly Doula, I am fluent in ASL. The issue is not availability, it's visibility. We're going to talk about the cultural competency of it. That means, as a Deaf Friendly Doula, we respect your traditions and your family, which means I respect your language. We understand that English is not your first language, sign language is. For deaf families, language opens the door, culture means care is meaningful, and advocacy means it protects and empowers families. And as we always close out with my favorite rule of Will 93, prepare, practice, and perform. I'm Noni. Thank you for tuning in to Deaf Friendly Doula.
I know you got me. Rise up, sister, and let your voices